Hi, I'm Haley Blackburn from 300 Analytica, the firm contracted to help the Colorado Department of Justice assess cannabis impairment protocols, and ultimately, I will be giving a recommendation based on what we think, the DOJ should adopt given Amendment 64. Now, cannabis impairment and the concentration in the blood impacts drivers a little differently than alcohol, which is why we need a new protocol. You can see they're really, really similar, but at 0.05 grams per deciliter, THC really levels off, whereas alcohol, shoots up, especially at that 0.08 level. So we just have to be mindful of that in the protocols and the tests that we looked at. So we considered blood testing, urine testing, saliva testing, which would just be swabbing their cheek or the mouth, and then adapting your standardized field sobriety testing that you already know as a way to kind of test that physical cognitive abilities at that 0.05 level and above, kind of the buzziness. So our research framework, we're looking at cost, staff training, equipment, safety and risk levels, especially with liability, and then of course the effectiveness, your ability to really determine who is a risk out on the roadway. And given that kind of buzz level of driving. So our costs, blood testing is the most expensive by far, whereas adapting the standardized field sobriety test is the most cost effective because you already have all that equipment, you're aware of it. It would really just be a retraining process. And then the other two that require transportation and labs are going to be in the middle. As far as the risk level, blood testing, high risk, mainly because of the liability and the presence of bodily fluid, whereas saliva and urine are much lower risk levels by nature of how you collect the sample, and traffic is the main reason we'd be concerned about the standardized field site sobriety testing, as you are aware of. Effectiveness on this first line, I want to point you to blood is going to be the most precise. It's going to tell you exactly, the nanograms per milliliter. Urine is a more general quantity though. Saliva is simple positive negative testing, whereas your SFST is that qualitative assessment. Now, residual metabolites with THC are much more of an issue than with blood alcohol levels. So if you did a blood test, you could detect things up to 90 days after use, which, doesn't really help you with who is a risk right now on the road. Whereas SFST is going to tell you right now you're a risk, and saliva looks at 24 hours. So kind of in summary, you can see on our stoplight view, blood has the most red lights. We've really kind of eliminated that one. And SFST has the most green lights, whereas saliva and urine are going to be a little bit in the middle here, which is going to lead into ultimately our final recommendation that the DOJ should adapt the standardized field sobriety test, because it can tell you right then, right there, you are a danger on the road. But saliva testing for confirmation that it actually is THC and not some other drug is going to go a long way in helping identify these suspects. So in the future, just remember we have several other services at 300 AMS. As you move forward, we can do a full feasibility report for you. We can write training manuals and information guides, anything to help transition that process into this new protocol for Colorado. So thank you so much, and please contact me with anything.